Well, greetings again, and I'm Dr. Bill Wyatt, by the way, with the American Orthodontic Society, and I wanted to look into one thing in the dealing with teeth. Teeth have an eruptive force and the upper teeth grow down and the lower teeth move up. And the upper teeth a lot of times drop further than the lower teeth come up. And so when the teeth run together and they have a force there, then the teeth stop erupting. And that was what develops this distance between your nose and your chin right in here. So if you run around with your mouth open too much or you don't swallow properly, the adult swallower, you bite your teeth together every time you swallow. If you don't, if you have an infantile swallow pattern, you don't bite your teeth together. And God made it that way so nursing children don't bite together like that. And so if this carries over into adulthood, probably if you're out there watching, you won't be able to swallow without biting together. Now, I've practiced and showing people that you can do it by kind of putting your tongue up here, and you can swallow without biting your teeth together. But normally you bite down when you swallow, and that's one reason something goes wrong with the TMJ back here, and every time you bang into that tissue, you get hit, and you have a sore tissue of the retrodiscal tissue that feeds the disc, feeds the whole disc and everything, and it gets swollen up, and every time you swallow, you bite and press the condyle into that sore tissue, and that just gets to be a tremendous pain for people. And that if people tell them they go look around, they used to not know what is wrong with them, and they tell them that they're going crazy or something like that, and they would just nearly that way. So you've got to realize when you go look and you can feel feel the condyles, you know what's going on. If it's one of them sore, that's the reason for this ache on shoulders and headache and everything else. All right, we're back to the over-eruption where teeth are coming in the mouth. Now, if you take the tooth out below one and it has nothing to touch, the upper tooth will continue to move down. It doesn't get any bigger or anything. It just kind of carries the bone with it and it moves down. And we've shown that with doing these blocks. You put block on one side and leave it about 3 months. These teeth will have a gap in them, but when you start, and they'll close all the way together on this side. Then when you get your problem, and you're through with it, you take the block off, you bite down, these teeth hit, and these will have a gap about like your finger, and you worry about it, but don't worry about it. This will erupt over here, and it'll level back up again. And you put something in here, then these teeth right here close down. And so you can do this sometimes helps you regulate the whole level surface of the teeth coming together. Now this case I've got here is an excellent showing over-eruption, but I don't have a lot of slides on it, but I wanted to show it. It's such a good example of over-eruption. So let's get on with it. All right, here it is after we worked on it a while and we got the teeth lined up. But, well, no, I'll take that back. In the back part of the mouth, somebody had extracted the tooth here and extracted tooth here, and these teeth moved up into that. This tooth dropped all the way down in here. This one went all the way up there. Now, in some people, this goes faster than normal. And these teeth weren't hitting out here, so we got some closure of the bite right here, but this is all closed down. Now that we're going to come in here and put a retainer in here and put a acrylic saddle. And we'll put one up above and put a saddle in here and put something that hits and let these other teeth come to kind of line it out like that. I don't have enough pictures so to really show you what's happening, but that will happen. In other words, the gum is, the teeth don't get any bigger, but they just move and they carry their bone with them. And so you'll have to fix a little gadget to go in between there. And on the other side of the mouth, the same blooming thing. This tooth is coming up and bumping the tissue over here. This one's coming down. And they're chewing up here in the front part of the mouth. These teeth don't hit when you swallow. They don't hit when you chew. And this person's in pretty bad shape. Now, I don't have enough slides to show you everything on here. Now there's a tooth out here. Here we got the tooth, but this tooth over-erupted, and this one has too. All right, that's on the bottom. We've got the two molars back there, and that's all we have. And they've erupted down there. So here we go. We're going to try to see what we can do here. And I just level the teeth out. We don't have teeth that drag up and fill up this area. So we'll make a little retainer. Then I put a drop down arch wire in here, you see, and to expand this arch and hold the thing together. Now we put the drop down arch, and I'm pulling this back, trying to get this root lined up. And so we put something for this to eat, the arch wire. This is holding the tooth. The arch wire is doing part of this work for us, you see. And so here we've leveled this out. Now that opened this up, and you see this is separated back here. And this is a perfect example of this. And look at the age, 40 to nearly 50 years old. They're doing this. And the bone moves on people as long as you're living. And you can do these things. And this is something with adult orthodontics that we ought to be covered. And there's many orthodontic schools, they do not teach you. They can't go in. So I have started from before birth till the people pass away in trying to show orthodontics. And this is a perfect example of it now. Let's see what. Now here we made these little saddles, and we keep adding to this acrylic until we push that tooth up that place. So we'll go back. So we wore that thing, and we would add a little acrylic till we kept pushing on that tooth, and it would shove this one back up. Same thing over here. We did that. And that's a simple little thing you can make in the office. You wear that. Now there's the upper and the lower one. And we level this bite out like that. Now, who can put a price on what you've done here? A lot of people say, well, we're just going to take your teeth out and make dentures. You're going to fill that in with a partial or something like that. Everybody ought to understand the orthodontic movement of these teeth. We put little saddle pieces in here, and we could thicken that and add the material to it until we push that tooth all the way back up where it ought to be and level this out. Now you can come in there and put an implant or a bridge or whatever you want to and fill the space up. This is the kind of orthodontics that the university-trained orthodontists ought to be doing, and they're not training people to do a lot of these things. And so if you're out here looking and you find your teeth are like that, and you go to your whoever's doing your work and they don't do it, show them what it can be done, and maybe they can come in and look at it and do this for you. I don't know any other way. I'm trying to get people trained in the American Orthodontic Society where they know how to do this when you walk in there. We're hoping they do. So that's what we've done here on this particular case. I think we had those things backwards in here. One place we got teeth over here. And there's those little saddles. We had them setting in here. We put arch wires to pull the roots in place, and we would add to these things until we jack the tooth back into place using the occlusal force to kind of back the teeth up. And you can do that too. And so that's the way that works. I wish I had a little better picture system here to show you. And so anyway, we got this person back in shape like this, and their teeth are hitting in the back, and they can put bridges, implants, whatever they want to in there to fill those spaces. And this changes the whole life of that person. And that is the most gratifying thing I know of. And it gives me a lot of satisfaction. Now these teeth were a lot longer than this. You see, they're worn down. They just, over a period of time. This person only ground their teeth back like that. All right, I'll shave. So there, that's raised up, and they had bridges put in, and those look like gold bridges. So it won't go down again. And that's where it started, and that's where we took it to. Thank you for watching, and hope you'll join our group, subscribe to it. And this is adult orthodontics. This is stuff that we're doing on older people, and there is a world of this out there that's going untreated. That orthodontists come out of dental school, they haven't done any of these long-acting, older cases like this. Maybe many of the guys are just talented and they'll learn how to do it later on. So I hope you take this and can learn from him. You can do this. And this guy's 50 years old or something like that. And you can do that, and and these teeth, if he takes care of them, they'll be that way when he's 90 or 95. Thanks again, and I'll sign off here.